Okay.
People out in the breakfast area still coming into the hall, but we've got a great crowd again, so thank you very much and welcome to the Ounce of Prevention Conference 2011. And we are very pleased that we resumed this conference after a 4-year lull in the previous administration. We had to think about how long have we been doing this. This is the 14th Ounce of Prevention Conference. Probably not in the room, but we thank you very much. You're going to have opportunities to learn not only from these national public health leaders, but also from the incredible array of presenters that have agreed to lead the plenaries and the workshops. So we want to thank all of the presenters very much, and you'll be learning from one another as well. So we thank you for your participation. Dig right in, roll up your sleeves, network, learn, and take back what you learn to your communities and organizations so that we can strengthen public health and strengthen prevention across the Commonwealth. And now it's my pleasure to bring on Commissioner Auerbach. Thank you.
Good morning.
Good morning.
Thank you for being here. I know a number of you have really traveled already quite a distance to come, and really appreciate that. And Jeff and Kathy and the members of the Planning Committee, thank you very much. I know that it's never easy to do all the logistics and planning that needs to occur in order to make a conference a valuable experience, and clearly a lot of thought has gone into that. So it's my pleasure to be here, and I'm happy to offer opening remarks. I'm very pleased that the conference's theme is communities taking charge, making change. And the Planning Committee, I think, wisely chose that theme because it was one that emphasized the importance of policy change at the local level, at the state level, at the regional level, and making those changes in order to promote health, reduce disparities, and prevent injury and disease. And the theme is really related to the notion of moving us to the point where we're creating healthy communities so that the healthier behavior is an easier behavior, that it's not, there aren't enormous challenges that always exist in the way of being healthier. And that's partly also related to a belief that we have to work on the social determinants of health and really try to understand how we can create social and economic neighborhoods, workplaces, schools that promote health. And so the theme of the conference is an excellent one. So now I have a real treat. Well, one of the things I don't think we do enough in public health is I don't think we do enough are known as Commissioner's Leadership Awards. They recognize outstanding work that's being done in communities throughout the state, collectively by different individuals and different groups that are already showing the results of the work that they've done in terms of improved health and reduced risks. So the first of the awardees is the Revere Opiates Task Force. Revere Cares from the city of Revere. Revere Cares Opiate Task Force was originally established in 2004, and it was established in response to the growing concern about opiate use in Revere. And there Revere saw increased overdoses and the disturbing pattern of seeing younger people using heroin and other opiates. The task force consists of dedicated individuals, and they represent many different sectors of the community, including parents and other residents, local government agencies and officials, first responders, as well as healthcare and treatment providers, and the recovery community. So the task force began its work with a rapid assessment of what the risks were, what needed to be done. This led to several outcomes, including the establishment of the Revere Beach Memorial to reduce stigma associated with alcohol and drug use, the revision of the opiate prescribing practices and pain management training protocols at the Mass General Hospital Revere Healthcare Center, a very good model of what can by clinicians to rethink their prescribing practices. The funding of an intensive adolescent outpatient treatment program at the North Suffolk Mental Health Center. And then this work has continued over the years. In 2008, with the Mass Call 2 funding from the Department of Public Health, the City of Revere and the Opiates Task Force conducted an assessment, identified the target population, and developed and implemented a strategic plan to address opiate overdose use in the community. Evidence-based trainings, educated active users, bystanders, and service providers about overdose prevention and response. Prevention strategies included the development of a first responder Narcan pilot program at the Revere Fire Department, the creation of a resource center for active users and bystanders, the establishment of a citywide medication disposal program at the Revere Police Station, and the legislative advocacy for the Good Samaritan Bill to encourage individuals to call 911 in the event of an overdose without worrying about arrest. And this is clearly having an impact, because already as we look at evidence of overdoses through the Revere death certificate data, we're seeing that opiate deaths in Revere are on the decline. So please join me now in thanking and recognizing the team of individuals who are representing, I think, a much larger team of people who've worked in Revere for years to make a difference. I'm going to mention the people who were in the team and then ask for your applause as they come forward. Kitty Bowman, Chief Terrence Reardon, Kim Hanton, Gary Langus, and Chris Alba. Please come up.
Revere Cares would like to thank the Commissioner for this award and this recognition. But the recognition and award really belongs to a lot of people who aren't in this room, including 400 young people who walked for recovery 3 Sundays ago. Thank you.
Our next award is an award for an organization that's made a significant difference in terms of making healthy foods available to people throughout the state. It's the Community Involved in Sustaining Agriculture, Incorporated. Based in the Pioneer Valley, Community Involved in Sustaining Agriculture, or CISA, works to strengthen connections between farmers and communities in order to improve access to local farm products and to build thriving farms that are both economically and environmentally sustainable. CISA helps consumers find and buy local through their Be a Local Hero, Buy Locally Grown public awareness campaign and Farm Products Guide. CISA also works to scale up the local food system, making locally grown food available in all of the places that we live, work, and eat. For example, this year alone, more than 202 farms, 46 restaurants, 31 grocery stores, 8 landscape garden centers, 8 specialty food producers, and 12 institutions have joined together to raise awareness and sales of locally grown farm products. This effort has become a national model, with replication throughout different parts of the United States and even Canada. Currently, CISA staffs PV Grows, a collaborative group of organizations whose goal is to enhance the ecological and economic stability of the Pioneer Valley food system, PV being Pioneer Valley. CISA has innovative programs such as the Farm to Firm program, that partnered farms with workplaces to set up farm stands or community-supported agriculture distribution. And CISA also started a senior farm share program which provides low-income seniors with 10 weeks of fresh produce directly from the farm. 96% of farmers responded to CISA's 2010 farmer survey, reporting that their farm business was positively influenced as a result of CISA's work. Over 82% of the Franklin and Hampshire counties recognize the local hero logo that CISA developed, and people who recognize the logo are twice as likely to buy local. So the challenge with increasing healthy produce and availability, the devil's really in the details, And the organization that's figured out how to do the details well is CISA. So please join me now in thanking Phil Corman, who will be representing the terrific work that CISA does.
It's beautiful. So it's an incredible honor for me to be able to represent the 200 local hero farmers and hundreds and thousands of residents in Franklin, Hampshire, and Hampden County to receive this award. Our mission is very clear. We want to strengthen local agriculture by connecting farmers to the community. And so I want to ask two quick questions here. One is, how many people in this room eat? How many people in this room are farmers? These are the people you need to connect to today to learn more about what it means to grow food for the rest of us. And I do want to say that it is so vital to have public health advocates involved with local agriculture. You know how to take a look at systems, you know how to take a look at policy, you advocate well, and you think of things as a whole, and you're always thinking of creating community wherever you go. So please remember, you are what you eat, but what you eat depends on what you grow. And I thank the farmers in the room for growing for us every day. Thank you.
Jim Marks. Dr. Marks is the Senior Vice President, and he directs all program and administrative activities of the Robert Wood Johnson Foundation Health Group, and that includes the Foundation's work on public health, on vulnerable populations, and on much more. Let me say just a minute or two about the Foundation itself. The Robert Wood Johnson Foundation is one of the largest foundations in America. It's in the top 5 in terms of just the size of the foundation. It's one of the largest foundations in the world, and it is focused on health. And so it's the largest foundation that's health-focused in the country. He has been the one that's been in the forefront of many of those programs that I've mentioned, and in particular in the ones that are nearest and dearest to our hearts in public health. The ones that really are about strengthening public health at its core, at its roots, about thinking about the populations that we care the most about. His insights, his advocacy, his knowledge and competence have been extraordinary. And there's no better friend to public health than Dr. Jim Marks. Please join me in welcoming our speaker.
John, for that very generous introduction, and you'll hear in my remarks a number of the themes that John, can you hear me all right? That John commented on in his remarks. It's a real pleasure and an honor to be here with you. I want to give you a little context for Foundation's work. At the Foundation, thank you. The Foundation has no authority to do anything. It has no responsibility to accomplish anything. We have limited money relative to the size of the problems, and we can't lobby. From that base of strength, we try to change society in ways, in our Foundation's charter, in ways that improve health for the nation as a whole. Now, I struggled with what would be useful, informative, and challenging for this conference without going too much into the obvious huge issues facing the country, especially since, as again you heard from John, Massachusetts has come further in facing some of these issues than almost anywhere in the nation. He also did some of what I'll do in highlighting some depressing and challenging issues. But it's really impossible to talk about the big picture in public health and health care and not talk about the economy. Very bluntly, we are in a period of economic challenge that could change the future of this nation. And only in part because of that economic challenge, we need health reform that is both intelligent and sweeping. The medical care system we currently have is failing us, and any statement to the contrary is no longer credible. and is becoming a big issue in our country's global economic competitiveness. Now, I'm not going to talk a lot about the Affordable Care Act, but I want to highlight one aspect. The debate last year had one major element that was missing from the debate in the early 1990s: prevention. Several key prevention elements were included in the Act, and early on, those prevention-oriented components had a lot of bipartisan support. Unfortunately, the debate has become more heated. Various positions on the bill have become more and more all or nothing, and that has affected support for the prevention elements. But regardless of how the Affordable Care Act turns out, we cannot continue to delay the efforts to have a better balance between preventing illness and injury and treating and repairing that damage after it has occurred. Those that are too poor to afford health insurance get charged the most when they are sick. In our current system, even people with insurance are still at risk for bankruptcy if their bills are too large or their deductibles don't, or their proportion covered doesn't cover everything. We have more disease than other countries, and other countries spend far less, are healthier, live longer, and insure almost everyone. It's hard to imagine how we could have done worse. So with that as context, what I will talk about is where I think public health needs to go over the next few years and how these challenging times offer us a huge opportunity. We just need to position ourselves to take advantage of it. The goal of public health is to change society so that people are healthier and disparities in health between groups or communities are diminished. I'm going to give now some context. How many of you know who Warren Zevon is? Warren Zevon's a singer who's probably best known for his song Werewolves of London. Well, he had a moderate hit before that, in the late 1970s, called Lawyers, Guns, and Money. In listening to that song about a year ago, it occurred to me that the words in the title were essentially a list of the ways to change society. Now, it's clear that public health will never have the brute force behind it that's implied by the guns element. It'll likely never have the money behind it that tobacco or alcohol or the less healthy parts of the food industry do either. So we're going to have to rely on lawyers, on the law, as the principal means to improve health. And while it's not guns or money, it is a powerful lever. To clarify, when I say law, I also mean regulations and policies, even non-governmental private sector policy, and I'll tend to use them interchangeably. Bill Foege, the former director of CDC and the past president of the American Public Health Association, said that every public health decision and every large resource decision is really a political decision. And that's why public health cannot stay out of politics. Now, he was not talking about partisan battles, but rather the leveraging of the stature of public health leaders to get the policy-making system to work for health. We're at a watershed time in our nation's history. We have to be honest with ourselves as a nation. Technologic advancement, where our nation's leadership is unquestioned, has failed to rein in the growth in medical care costs, nor has it even enabled us to have better health relative to other countries of similar wealth and development, according to standard big picture measures of health outcomes, like life expectancy and infant mortality. In fact, even as we have increased our medical care spending by more than $1 trillion each year over the last decade, we have gone down in international ranking. Other countries doing other things differently than we are getting healthier faster than we are, despite our rapid increase in dollars spent on medical care. The fact is that the likelihood of initially becoming ill or injured, especially prematurely, is really about whether one smokes, what and how much one eats, whether you're active, the safety of your neighborhood, the toxins and microbes and conditions you're exposed to, where you live, learn, work, and play. This must all lead us to conclude that the major disease problems of our society and time will not be solved by more medical care. What we really need isn't more expensive treatment. What we really need is less disease. In fact, without less disease, we are fast finding that we cannot afford to provide the good treatment that the medical sciences have developed for those who do become ill or injured. So even our hopes of good quality medical care for all those who need it is being put at risk by the excessive amount of disease and injury we have. As a nation, we have to think differently and look elsewhere for potential solutions to public health on all it entails and all the partners it must engage. We've had an enormous imbalance regarding where we've looked as a society for sources of health and illness and sources of disparity. I've tried to spend my time today on how public health can lead and become a stronger force for societal change. But this will only happen if we can link the science of health to the leverage society uses to make changes. Now, John moved on from his discussion of the depressing part of his talk to 5 reasons for optimism. I want to close a little bit on that point. I believe that optimism is the only scientifically defensible position to hold in public health. Why do I say that? Around 1900, life expectancy was about 47 years. Now it's about 75 years in our nation. About 250 infants born alive would die before their 5th birthday. Now it's probably in the neighborhood of 10. So almost every family, on average, would have experienced the death of an infant or a young child. Now it's uncommon. The leading causes of death were diarrhea and respiratory illness. They're now uncommon causes of death for our nation. I believe that no other area of human endeavor has come closer to achieving what would have been considered utopian goals than has public health. And you all in this audience know that most of the improvements that I described were due more to public health measures than they were to medical care. So you can see why I say the only scientifically defensible position that we can hold is optimism. Thank you very much.
Thank you very much, Jim. I saw a lot of nodding heads, especially towards the end of your remarks.
There were some societal forces that weren't mentioned. I know you had a limited amount of time, but they seem to be important in this discussion, and I was wondering if you could speak about them. One is the growing prominence of anti-science beliefs in this country, and the fact that anti-science beliefs seem to have risen to a level of equivalence to science as an option. This is accompanied by the fact that anyone can be an instant expert by posting a blog on the internet. So we've lost what were previously respected experts for a public health approach. I wondered how we address these alarming trends.
Great question, Suzanne. I'm going to put those in context. I think that they're part of the same, that anti-science, anti-government is part of the issue of lowering support and acceptance of authority of various types. And science and scientists often frame their findings as a type of authority, and that the quality of the evidence is important and obviously has value. But I think that where we are seeing a growth, and I think that's part of where how I was trying to frame public health leadership, is that other sectors know that they have responsibility for certain areas. And we need to have them think of health as an issue and science informs that decision. Science will not always carry the day, but if we don't use science, we only have an opinion like anyone else. With science, science gives us cogency. There'll be times when the science we use is immature or incomplete and we have to make decisions, much like an oncologist is going to treat someone with cancer that they have in their office, even though they know that there might be better research coming. Public health, much of leadership has to act sometimes when the evidence is not clear. I think the part that is the most difficult in this is it is so easy to take those shots at science, at government, at other forms of authority. And it's done in a way that doesn't build up other forms of knowing what one should take into account when one acts. And I think that that's the biggest difficulty. And while I talked about leaders most in my remarks, the part that I didn't talk enough about, and New England is the best place for it, is you build up from community as well. You cannot do it from just at the top. You've got to build up from community. And we're going to have to harness that. And one of the things the blogs and the internets offer is not just a greater risk for some points of view, but a greater opportunity for others, for people to see that there are things that they can do. So I think that the debate about, and I could go on for this for a while, of personal decision versus societal responsibility is in fact also at the heart of some of this. But we know that there are many millions of people who live in situations where making healthy personal choices is almost impossible to make. On the other hand, even if families think that it is all on them, they're wrong. They need to say, what's happening in my schools? What's happening in my towns? Are we getting sidewalks? Are we getting a grocery store if we don't have one? So that there are local policies that they can get behind that are also part of their personal decision making. Thanks for the question.
I apologize to those of you who are standing at the mics. We'd love to go on, but we're going to have to get on with the day. Dr. Marks, thank you very much. Commissioner, thank you very much. Thanks to all of you.
So I'm going to begin with the Southeast Massachusetts, and the program is the Southeast Community Health Assessments Project. In the past year, 3 community health networks, as we call them, CHNAs, in the Southeast region, the Greater Brockton Community Health Network, South Shore Community Partners in Prevention, and the Greater New Bedford Allies for Health and Wellness, have carried out exemplary and creative community health assessments with extraordinary leadership and technical assistance from Bonnie Andrews, the community health specialist, and the Southeast Center for Healthy Communities. So the community health assessment is the foundation for improving and promoting the health of residents, as we've been talking a lot about today. Bonnie provided leadership in motivating and managing participants to complete community health assessments that covered multiple communities. Bonnie provided technical assistance in facilitating focus groups, conducting key informant interviews, holding community impression sessions, analyzing mass chip data, and developing qualitative survey questionnaires. Bonnie assisted a volunteer community group to develop and implement a process to assess the strengths and gaps concerning community health issues, with particular focus on the department's public health priority areas. With full support from each CHNA, the resulting reports went beyond the graphical representation of data to include commentary from residents, as well as interpretation of the data and its importance to understanding the social determinants of health. The reports provide a rich resource to the CHNAs and other community-based organizations in data-driven decisions about, I lost my place, I apologize. I told you I couldn't read this small writing. resources, so anyway, to help with allocation of resources and to support grant applications. An important consequence of the community engagement strategies that were highlighted in the reports have been the cultivation of new relationships and the nurturance of existing relationships that can contribute to an effective community strategies to address key health problems through community-based projects as well as policy development. And these community health network, these community health assessments represent data in the service of community. So receiving the award, Bonnie Enders from the Southeast Center for Healthy Communities, Linda Grayback from the Brockton Jna, and Marianne D'Souza from New Bedford. And I don't think someone's here from Plymouth, right, today, but, so come on up. Oh, I'm supposed to give this. I know you were supposed to give it, but that's okay. Well, that's what partnerships are about, you know. There you go.
Picture.
From the Northeast, Central, and Western Massachusetts, and it's the pilot program to address disparities in diabetes for school-age children. This pilot program was done in collaboration with Fitchburg-Leominster and UMass Memorial, Springfield and the Bay State PD endocrinologists, the Billerica, Lowell, Lawrence, and Children's Hospital of Boston. As part of the Essential School Health Services Continuous Quality Improvement, about 37 school districts collected data from about 589 students with diabetes. After evaluating the data, the nurse leaders of certain districts realized that there was a great disparity in the treatment modality of children with diabetes, and that it seemed to follow students in lower socioeconomic areas. The resulting pilot program targets 6 of the communities with the most disparities: Fitchburg, Leominster, Billerica, Lawrence, Lowell, and Springfield. The collaborative identified the neediest students with diabetes and their parents. They arranged for home visits from PD endocrinologists and educational programs for students and their families. In less than 6 months, the increased collaboration between students, families, and healthcare professionals resulted in decreasing A1Cs, which I think are blood sugars, the 3-month indicator, oh yes, that's it, 3-month indicator of a good blood sugar glucose control for the diabetic students in the lower socioeconomic areas. And so who's present today to receive the award? Pamela Rivera from Fitchburg Public Schools, and Carol, I should have practiced these names first, I think it's Boots from Billerica. So, come on up. And I apologize for saying the names wrong. Carol Bootsy. Grow Food Northampton. In just 17 months, Grow Food Northampton went from a listserv to a farming powerhouse. When local farmland was put on the market, the Grow Food Northampton transformed itself into a nonprofit corporation, mobilized the community to raise funds and political support, and turned a dream into the reality of 121 acres of preserved farmland. They signed a long-term lease for a local farm, Crimson and Clover, to farm a large parcel of the land. They work with the City of Northampton to ensure land for community gardening and recreational fields. They work with the Land Trust to manage and purchase the sale of land, and through vision, energy, and commitment of Grow Food Northampton, residents will for years to come be able to enjoy the land, grow more food locally, and ultimately be less dependent on food transported from around the nation and the world. Executive Director Lily Lombard is the leader and driving force behind Grow Food Northampton's success, and is a shining example of how one person and a small group of people can transform a community. And so receiving the award today is Lily Lombard and Adele Franks.
No photograph?
Of course.
I give a personal thanks to Adele, who deserves equal credit for all of the hard work and the many hours that went into this. I think what sparks most people's imagination about what we accomplished is that we started out as just ordinary citizens sitting around a kitchen table saying, we care about the future of this prime farmland, and if no one else is going to do something about it, damn it, we are. So it was, it started as a little nugget, just a vision, and then we managed to make it go viral and grab the support and the enthusiasm of so many other collaborative organizations, including our health department, including our city planning office, local businesses, and tons and tons of individuals. So I just love what we did, and I'm so grateful that you see the connection between what we were able to accomplish and public health. And I encourage other communities to act as boldly because, you know, these things can happen with a small group of committed citizens. So thank you.
Our next award is for the Greater Boston area, and it's for Community Servings, Inc. Community Servings provides food and nutrition services throughout Massachusetts to individuals living with critical and chronic illnesses. As Community Servings celebrates 21 years of operation this year, they have served over 4.4 million free meals to the critically ill since 1990. Helping those from Boston's most disenfranchised communities fight hunger and illness. Community Servings strives to help clients suffering from illnesses such as HIV/AIDS, cancer, renal kidney disease, and multiple sclerosis to maintain their health and dignity and preserve the integrity of their families through free, culturally appropriate, home-delivered meals, nutrition and education, and other community programs. This year, Community Servings will provide 383,000 free meals to the critically ill and more than 3,000 hours of nutrition education to 2,000 individuals. Community Servings work extends to the High Jackson Square community in which it is located, and through its weekly farmers markets, one of the highest redemption of SNAP benefits of any market in the city, nutrition classes, community-supported agriculture, and community-supported fisheries programs, and a collection of 30,000 pounds of surplus farmers' produce. Community Servings demonstrates the abilities of communities and community-based organizations to take charge and make change. And receiving the award is Rosario Dominguez. And also David Waters.
She said, what if nobody shows up? She didn't count on unannounced people showing up. I'm David Waters, the CEO of Community Servings, and we just wanted to say thank you to DPH for the award and to do two quick messages. One is that we think of nutrition as a partner with Western medicine and a very important piece of prevention. And so we're expanding our nutrition education program over the next couple of years, and we'd love your help. Equally or more important, we are feeding people in 17 communities and about to expand to Worcester. We just expanded to Lowell. And we are always looking for referrals, and you guys are on the front lines. We would love to have more people know the importance of home-based nutrition care for people coming out of the hospital, struggling with illnesses, or perhaps at end of life. So please think of us and refer people to us.
Plumley Village Women's Group. The Plumley Village Women's Group, grassroots leadership and success in establishing a community garden is bringing homegrown produce to the residents of Plumley Village, a 430-unit low-income housing complex in downtown Worcester that is home to more than 3,400 people and 700 children. 4 years ago, the women met for the first time to form a weekly exercise and nutrition club facilitated by UMass Memorial Medical Center's literacy coordinator, Sarah Lindgren. After attending a workshop on healthy food choices, they realized that there was a lack of affordable fresh produce in the neighborhood and no access to a farmer's market. The idea to start a community garden took root. After 4 years of planning and hard work, the women broke ground for the garden in May of this year. They moved rocks and constructed raised beds with the assistance of the Worcester's Carpenter Union, local teens, and the building management. As the first harvest time approaches, 24 families are enjoying and sharing of many varieties of healthy vegetables from their garden plots. The women are already looking forward to next spring, and they're considering a greenhouse project to make the gardening possible year-round, and they need your help to do that. Through their collaborative spirit and everyday involvement by the Plumley Village Women's Group, the garden is not only a source of pride, but also proof of commitment to the neighborhood and a healthier lifestyle. This community took charge and made change. I'll read off their names, as well as 2 folks from UMass Memorial that helped with the project. So the 2 UMass folks, Monica Lowell and Sharon Lindgren, and then the women, Delilah Santiago, Marissa Maderia, Vicky Bori, is it Ada? Ada Gauthier, and Evelyn Rudy. So please come on up.
Thank you.
The West region goes to the Institute for Community Health, which was founded in the year 2000 as a partnership between the Cambridge Health Alliance, Mount Auburn Hospital, and Mass General. The work of the Institute embodies leadership and the promotion of healthy communities with a particular focus on the cities of Cambridge, Somerville, and the surrounding towns. From the beginning, ICH has demonstrated an extraordinary commitment to improving the health of its communities through capacity building, facilitation, and collaborative sponsorship of community-based participatory research, evaluation, assessment, educational activities, and dissemination. In particular, ICH's work exemplifies creativity in the effective use of data to drive decision-making and demonstrated success in affecting community change in areas that include obesity and youth suicide prevention. ICH has worked with community partners from various sectors, spanning a wide range of content areas and populations to build the capacity of community organizations to more effectively collect, analyze, interpret, and translate local data to influence policy and practice. And I don't know, Karen Hacker was at least meant to receive the award, but I'm not sure. Are you here, Karen? Oh, yay! I had this little method of trying to find out if people were there because we had their badges, and your badge was on the table, so I didn't think you were here, but that's great.
I got waylaid.
Thank you. Oh, no. You can't be in a picture all by yourself.
I'll get a picture. All the way out to Springfield and beyond. And they're not here today, mostly because they're working. So I really want to just acknowledge them and thank you all.
2011, we will be together at this particular moment in this particular room. Because I won't say we won't be together in other places. I hope we are. So I just want to thank you all for coming. It's really all of the people that both helped to put this program together and all of the people that attend that is what contributes to making this a success year in and year out. And it's really so great to see all of you. There's some folks that I don't get to see very often that I always look forward to seeing, and I think probably everyone can say the same when they come to the Ounce of Prevention. So enjoy your workshops this afternoon, have a safe journey home, and we'll see you again in 2012.
Right. That's possible.